If you're interested in starting the Semaglutide weight loss program at the Elements of Therapy, this is what to expect as you begin your journey. We will set up a free consultation phone call to review our initial 12-week program details and pricing. Once you agree that you want to move forward, you would then schedule a medical consultation with our medical provider, Cindy Osteen. Before that meeting, we would send you medical health and intake forms electronically that you would complete and that Cindy would review with you at your medical consultation. For your medical consultation, we would give you the option to meet with our provider in person at our physical location, or we could set up a telehealth appointment if you would rather do it virtually. During this consultation, the provider would go over your medical history, your goals, and explain how the program can help you reach your goals. Once you decide you're ready to start, we would then need to order your medications and have them shipped to you directly, or have them delivered to our location locally in Jacksonville for you to pick them up. You will receive your medication, supplies, and other educational materials that will help you with your journey, such as dosing schedules, supplements, and weight loss nutritional tips. When you receive your medication, the dosing instructions will be on the outside label of the packaging. That packaging will contain the number of vials needed to fill your prescription. Here's what a vial of medication looks like. You will notice that each vial is not completely filled to the top, but this is normal as there are 100 units of semaglutide in each vial. So if your starting dose is 10 units, then you would use 1/10 of the vial. Keep in mind that there are no other medications or components added to the vials other than the semaglutide. In your packaging, you will also receive alcohol wipes and 31-gauge tiny insulin needles for your weekly shots. Before you get started, you will want to make sure that you are doing your injections with clean hands and on clean skin. Semaglutide can be administered in the morning, afternoon, or evening. It is not a stimulant, so it will not keep you awake. You can also take this product on a full stomach or an empty stomach. That's completely up to you. The shots feel like nothing more than a tiny skin prick. You will notice that the syringes are marked in units from 10 units all the way to 100 units. Before drawing out the semaglutide, you would remove the orange cap off the back of the syringe to expose the plunger, and then remove the cap that is covering the needle. You would draw out the correct dosage in units into the syringe. For your first dose, you would remove the blue cap on the top of the vial that can be discarded and thrown away. You would then locate the rubber piece on the top of the vial and insert the needle into this rubber and turn the vial upside down and draw out the correct amount of semaglutide in units as indicated by your prescription dosing instructions. If you draw out too much medication, don't worry, you can put it back into the syringe. Remember to not put the needle into your skin and then back into the vial, as this will contaminate the medication. You will need to use a new needle to draw out more solution, so the next time you draw from the vial, you want to utilize a new needle and clean off the top of the vial with an alcohol wipe before you insert the new needle. After drawing out the medication into the needle, you may see a bubble in the syringe. Simply hold the needle upright and flick the syringe at the top so that the bubble floats to the top, and then gently press the plunger so that the air bubble is pushed out. Now that you have drawn semaglutide into the vial, it's time to administer your shot. The most common areas of your body to inject are the areas closest to your belly button or on the outer thigh because it's easiest to see. Before injecting, you want to make sure to wipe the injection area off with an alcohol wipe so that it's clean. You will inject by first pinching your skin between your fingers where there's some fat and injecting into the area that you are holding between your fingers. Slowly inject the needle straight in until the needle is 100% hidden inside of your skin, and then begin pushing the plunger down until it stops. Once you are done, carefully put the cap back into the syringe and discard it. Now that you have done your injection, you will store your semaglutide in your refrigerator until your next injection a week later. Remember that you never want to store the semaglutide in the freezer. Depending on your goals, you may wish to continue to remain on the semaglutide for longer than the first 12 weeks. We typically recommend at least 24 weeks on the medication to reprogram your body and your brain to its new norm and to help prevent subsequent weight gain. This may be in the form of a small maintenance dose or a variable dose depending on your weight loss goals. If you remain on the semaglutide, you will want to set up a prescription refill consultation with your provider at least 2 weeks before you are due for your prescription refill to allow time for product ordering and delivery. If you have any questions whatsoever, please feel free to contact one of our front desk concierges by calling us at 904-265-4777. We hope to see you soon.